just press our
You mummified.
Yes.
Hi guys, so I am done work and I am going for my third appointment with Jazz. This is the third one by now. I'm sure you guys already know who Jazz is. She's my esthetician. This is how I look. The whole point of this is just to let you guys know that this is my face before. Well, it's right now, it's, let me look at my time. It's about 6:03 guys, if you can see. And this is how I've been all day. I left home at about, I believe I left home today at 8. So I've done nothing to my face and I feel like I look really hydrated. It is freezing. So I'm hoping that I'm going to get some, you know, cold glow and cold glow and all. I'm just waiting for my car to heat up. It's kind of frozen in here. It's 11 degrees according to my car, but I'm sure it's worse. It feels like worse. But yeah, this is the life I signed up for. So I'm just going to take off my fob because I am done work. I'm always so excited when I'm going to see Jazz. I don't know. I just really hope, you know how they say, you know, it's one thing for you to go to the hospital and get medication. It's one thing for you to go home and actually keep, you know, doing the things that you did while you're on the medications to prevent going back on the med. But so far, I feel like I've been doing good. Like, I find myself, like, I can't even sleep if I have not cleaned my face or at least washed my face. And I've been more conscious about, you know, how I touch my face. I think that's the most important change I've noticed. I don't touch my face as much as I used to. And also, I don't use just any product on my face. Like, I rather just wash my face with water than use something that I'm not really sure the effect. But anyways, guys, I've chatted enough. It's 6:06 and my appointment is 6:30. I got a message from Jazz saying, in case I'm running early. I actually never run early. But today I want to surprise her and actually be early. When I go late, not like Nigerian time because I'm Nigerian. It's like couple of minutes late, like, you know, fashionably late basically. But yeah guys, I'm excited and I'm sure you can tell, but I am far too tired to start screaming and all that, so I'm just going to start driving because I already feel my chair heating up. Like, I feel like it's heated up enough for me not to have a frozen butt by the time I get on the highway. So yeah, I will come back. Almost still, I'll continue vlogging later when I get to the clinic actually, and we are set up for the last. Well, she said it might not be the last. It depends on what she thinks or where she thinks my face is at right now. But we scheduled 3 chemical peels. So this, I think the first one was signature, the second one was a lightning lift. And when you hear lightning, I know the first thing you think about is bleaching. No. That's actually just like brightening your skin, basically, like letting the glow peek through. So this point is, I don't know what this one is going to be. So when I get there, that's what we are going to be finding out. I'm actually really enjoying vlogging with this phone. Guys, I got the iPhone 11 and the iPhone 11X Pro Max. Jesus. This is long, but I think I said it wrong. I think it's the iPhone 11 Pro Max. Yes. So anyways, I'm driving because everyone that came out of the office after me is zooming off, so I have to go, guys. Hello. Hi. I'm sorry I'm late.
No worries. The weather is really bad today.
You look so pretty.
Oh, thanks. This is a really good texture. I don't notice really any acne, like tiny little whiteheads here. So I would say you are good for microneedling, but how do you feel about it? Because microneedling may require a little bit more downtime.
Okay. So the microneedling, you know how you told me like the downtime, like it takes like 48 to 72 hours.
Mm-hmm.
Like how long before you see any downtime?
For the microneedling?
Mm-hmm.
So that microneedling is going to depend person to person, just like the chemical peel. Usually, like rosiness to the skin will last up to like maybe 3 days at most for people who are like much more sensitive. Okay. But then you might notice a little bit more of like sunburn peeling, so just kind of like dry patches on certain areas of the skin. It is also a treatment that helps speed up skin cell turnover. So again, like maybe these whiteheads are going to come up. So with the microneedling, because you do feel it, we do numb the skin for a few minutes. Okay. Pad that we work out of, and then the little pad. And then we use, of course, disposable needles. So one-time use, we don't share these. We don't even try to sanitize them. We use them and then we toss them out. Okay. So these needles can go up to 4 millimeters deep. Okay. However, doesn't mean that our goal is to go 4 millimeters deep into the skin. Really, the goal with microneedling is that we're going to the dermis layer of the skin. Okay. So the dermis layer is where all of that activity is. That is where you can find our fibroblast space. So that is where all the collagen and elastin is formed. Okay. And that is pretty much the main goal of microneedling. So another name for it is CIT, which is Collagen Inducing Therapy. Okay. So what we want to do is to reorganize our collagen as we age, other factors like environmental factors, acne, any other conditions that could affect the kind of disorganization of collagen. Yeah. We want to kind of restore that and create this healthier layer of skin, which in turn show that like healthiness to our outside layer of skin. So first, this is our ageless cleanser. So at least you can try it first, the ageless cleanser as well, to see if you like it. Okay. And then you're gonna have your Vital C mask, I believe is in there. Yeah. Oh, sorry, the serum, Vital C serum, so that you can use right away. And then also the sunscreen. Okay. So the daily
these are all like night
so
and
you
day,
use it
or just
night and day. Yeah. So same routine, night and day. Wasn't to go super deep. We're just trying to penetrate the dermis layer. So the dermis layer is different for everyone. Usually the average is about 2 millimeters. But the moment I start to see tiny specks of blood, that's when we know we're good. So I know that sounds scary.
So this is gonna go in my forehead.
Yeah. The forehead is the worst, only because of course it's the most boniest spot. So it just sounds like that, like a lot of buzzing. we're gonna start small. So do you see how those like little pins are going up and down? So that's how fast they go.
So I am done with treatment number 3, which happened to be my last treatment. So I got in there and Jazz was just so happy with everything, like my skin texture and how basically my face was reacting to the treatment. And she's like, I don't need a peel. Well, you guys, I'm sure you guys watched everything in the video, but this is how my face looks like outside in my car. Like I'm not in white light or anything filtering. She's like, how is your face like this? Because I'm supposed to look beat up apparently after a microneedling thingy. I'm starting to feel some sensitivity, so I feel like I'm going to feel more pain as time goes on, but I will try my best to take pictures every day, at least for a week, and I will just attach like a slide of pictures at the end to just show you how my face transitioned through the days, and then I'll officially close the video. Guys, I hope you guys have learned a lot from my skincare series, and it's been a life-changing situation for me, and I hope this video helps people. If you live in Canada, you live in Toronto, and you have like, you know, concerns, and you have things that you feel like this video addresses or kind of helps you, you know, puts you in the directional path to go ahead, contact Jazz. Like, she's basically my sister now. I can literally call her and tell her, you know what, this has happened, like what do I do, and she'll be ready to help me as long as, you know, she has an opening and all that. Well, yeah, other than that, I have a long drive, guys. I have to go home. Hopefully I don't meet any traffic. But yeah, I'm just going to insert the pictures for all the days. I'm going to take pictures for 1 week, so I'm going to insert them in a slide basically after this clip. So like I promised you guys, this is a slide of my face for the first 7 days. On day 1, you can see like I still have some redness and swelling. I posted the right and left side of my cheeks and my forehead. On my forehead, you would see more of the redness, and by morning it was fine. So today was day 2. I was able to wear makeup and I had a smooth finish for this day. And day 3, I started experiencing some breakouts at places that I never had breakouts before, and I believe these were things that were really expected according to my esthetician. I have shown my left and right cheeks. On day 4, I started seeing some drawbacks in the sense that my skin was looking tighter and the pimples were starting to diminish, and I was starting to feel, you know, and look less red, as you can see. And my forehead, you still see the pimples, but there's a huge reduction from day 1. Day 5, My forehead is like there's no pimples at all. My cheeks same, and I just felt like, very hydrated. I felt like, the better part of my skin was starting to show off. On day 6, I started experiencing peeling. So when I clean off my face with my usual cleanser, I was experiencing like dead skin coming off. As you can see, you would see some white specks. Those are like the skin peeling. And this is my update till day 6. Guys, to help you understand my journey, I had to show my face at the present day. Thank you for watching. Please like, subscribe, and comment.